Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith-Rogers. Today, Hantavirus, a rodent-borne virus that has killed and sickened people on a polar cruise ship. Stephanie Desmon talks to Kari, Debbink, a Johns Hopkins virologist, about what we need to know about Hantavirus, what scientists are still learning, and why this won't lead to another COVID-like pandemic. Let's listen.
Kari, Debbink, thanks so much for joining me.
Yeah, thank you so much for having me, Stephanie.
For people who are just hearing about the hantavirus, can you tell us what it is and why this outbreak has gotten so much attention?
Yeah, so first of all, hantavirus is a virus that is typically found in rodents and spread among rodents. And then in cases where humans come into contact with rodents, they may get sick, get the virus from inhaling like aerosolized particles of fecal matter, urine, saliva. So it's really usually spread via coming into contact with like rodent droppings or rodents. It's not a very common virus. And there are many different types. And so the reason why it's in the news right now is because there was this outbreak on a cruise ship. And that is extremely rare for something like hantavirus because it's typically found in like more rural areas where mice or whatever the vector rodent is are making nests and kind of living their life. That's not usually on a cruise ship. And so that's why this is garnering attention. And the other reason is that unlike most types of hantaviruses, there seems to be human-to-human transmission with this one, and it's been confirmed that it's Andes virus, which is the only type of hantavirus that has been known to transmit from human to human. And so I think that the attention that's been garnered around it is kind of a factor of this is a virus that is kind of rare, and then also that you're seeing human-to-human transmission on something like a cruise ship, and I think that puts a lot of fear in people's minds.
It feels to me like a cruise ship is a unique environment. People are super close to each other, spending a lot of time together. Is that why this was able to spread?
Very likely, yes. So kind of backing up a little bit, Andes virus is one of the types of hantavirus, right? And it is found in South America, very specifically Argentina and Chile are usually where the cases are documented. And there have been a few outbreaks in those countries where Andes virus has spread with potential human-to-human cases. Usually it's in situations where people are in very close proximity, like in a household, sharing a bed, or between somebody being treated and a medical personnel that maybe doesn't realize what they're infected with right away. And so when you kind of take a look at it this way, where this is a virus that, doesn't usually transmit human to human, but can, like with this Andes virus specific virus, and you bring it on something like a cruise ship where people are in close proximity to each other, they're in tight quarters, they're, in an enclosed space a lot of the time, you do kind of have the potential there then to spread it.
WHO has emphasized that this is not the next COVID. Why are public health officials relatively reassured, even though this illness itself is pretty serious?
Unlike something like coronavirus or influenza virus that really spreads readily through respiratory means, even though hantavirus, and specifically this Andes virus, is able to transmit human to human, again, it's only been documented in a very low number of cases to transmit human to human. And it's usually with people that have prolonged, very close contact. And so it's not something that you're going to walk into the supermarket and someone's going to walk by you and you're going to get it from them, right? It's like a household, sharing a bed, where you're maybe coming into contact with, bodily fluids from somebody. So, it's not transmissible as readily as other viruses. And so I think the potential there is not the same as something like coronavirus.
Mm-hmm. But the severity of the disease, what's that look like?
Right. So again, there are many different types of hantavirus, and those that are in the Western Hemisphere, including Andes virus and including Hantavirus, which is what we would find in the United States, have higher mortality rates than what you would find in Europe, Asia, Africa. And so what you're seeing with Andes virus or Hantavirus, which would be in the United States, the mortality rate is between like 30 and 40% for those viruses if a person progresses to respiratory symptoms.
I was going to ask, is it respiratory? Yeah.
Again, it depends on the type of hantavirus. So the ones that are in the Western Hemisphere tend to be a respiratory disease. And so the way that works is usually, in most cases, somebody is catching it from inhaling fecal matter or something from a rodent, right? And so the first thing that they do is they would be developing more of like a flu-like illness. So high fever, headache, muscle aches, and then that can progress to more severe disease, including like coughing, pneumonia-like symptoms. And then that can progress further to death in some of those cases.
I think a lot of us are scarred from the whole COVID virus situation. And I'm curious, how worried should most of us be about this particular virus?
With this particular virus, with Andes virus, the risk to us is basically zero. Really, the risk comes from those people that may have been on the cruise ship, that came into very close proximity with those people that were infected. But outside of that, or maybe somebody that sat on a plane with somebody that had it and didn't know they had it, it's pretty much zero. I mean, the nice thing is that the WHO is doing contact tracing for all of the people that they know that were symptomatic and that it tested positive. And so this is very likely to be contained very quickly.
There's a lot of public health investigators involved at this moment. What are they trying to figure out?
I think the main goal right now is just to make sure that the cases are contained. I think that's like the primary goal. I think maybe going forward, after they know that the cases are contained, there is a lot of contact tracing to figure out maybe exactly what the exposures were, like what kind of close proximity, and then that's maybe more relevant to like the science that will be able to inform future actions if there are these human-to-human Andes virus outbreaks in the future.
To clarify, it's not likely at this point that the first patient contracted this on the ship, right? They probably contracted it before they got on the ship?
That is what the evidence, I think, would suggest. So just to give a background for people that might not know, like the case histories. So initially, we didn't know what the case histories were, but the WHO has released that now. And so the first couple that really came down with symptoms, they actually had traveled in Argentina prior to boarding the cruise ship and had gone to places where the vector rodent for this Andes virus is. So it's very likely that at least one of them picked it up during their travels and then brought it on board, became symptomatic, was around other people, and transmitted it that way. And because these symptoms mirror those of influenza in the beginning, and these are, I believe that first person was around 70 when they passed away on the ship, they didn't really suspect hantavirus at that point. And so, people weren't necessarily like wearing protective gear or taking any precautions. It really wasn't until that person's wife was the second patient and she left the ship, deteriorated basically either in the airport or on the plane, and passed away very soon after that. And that is when they did testing and determined that it was actually hantavirus.
Why would you suspect hantavirus?
So you wouldn't suspect hantavirus, which I think is why it went for a week or two without actually knowing what it was, because it mirrors other respiratory illnesses. And so having one person pass away from a respiratory illness may not be super surprising, but then I think when there were more cases and more illness and they did a wider range of testing, that second person is when they found it.
As someone who studies viruses and transmission, what's the biggest misconception you worry people will take away from this incident?
Yeah, I think that there's a lot of fear based on the COVID pandemic. And I think that not everyone, understandably so, really understands that there are different levels of the ability of a virus to transmit. So even if something could be transmitted via a respiratory route, right, there are some viruses that do it way more efficiently. And there are some that are really not good at it. As an example, there had been other coronaviruses, right, before COVID-19. And one of those was MERS that emerged, a couple years before that. That one, unlike COVID-19, it causes severe disease, but it doesn't transmit very easily. And so most people that end up with MERS are actually people that are in a hospital situation where they're immunocompromised and they happen to be in an enclosed place with other people with the disease. So, there is just like this very big difference between the way, like how well different respiratory viruses could spread.
So what is the biggest unanswered question right now with this hantavirus?
I think the biggest unanswered question really is going to be how easily is it spreading? Like, is this something where only people that were directly treating this person in close proximity for many, many hours are going to get it? Or are we going to see some secondary cases from people that were on a plane or something before they knew they had it didn't have like super close contact, but were in the vicinity. So I think a little bit about how it transmits, how easily it transmits. I think we know that it's not a super transmitter, just because otherwise we would have many more cases than what we've seen so far. But I do think that there's a lot of question about exactly, what kind of contact somebody has to have in order to transmit it.
And I guess my last question is, hopefully this will be a very contained situation. What will this experience teach us about viruses? I guess we learn every time we do this.
Yeah. First of all, it will help with future outbreaks and like how to handle them, because I do think that this was something that people weren't expecting. I mean, you just don't really see hantavirus on a cruise ship. And so as far as like public preparedness and forming collaborations globally to help stop some of these outbreaks, I do think that is something that will come out of it. I think we'll know a lot more about hantavirus and how specifically Andes virus spreads between people. And then they're going to have a lot more sequence data and things like that. So there may even be ways that, we'll glean some information about the virus specifically compared to maybe other variants of the Andes virus and see if there are differences in the genome and if those impact things like transmission. So I do think that kind of on different levels, both like scientifically and as public health and preparedness go, there are definitely lessons to be learned.
Kari, Debbink, thanks so much for joining me.
Yeah, no problem.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacobelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.